So in a previous video, I discussed the COVID, CDC COVID community level data, and we walked through how this case rate per 100,000 is not being accurately depicted based on CDC's own data on these pages. What I want to talk to you now is about the COVID admissions uh, per population, and this, at least for Maryland, this number is pulled from a CRISP data source that is an data source aggregator for hospitals in the area. And I believe, from what I understand from the county health department, that this information is then pushed up through the state. But actually, it's my understanding that the CDC might actually pull this data directly. And so the state doesn't actually provide any of this data directly. And so there's no data source for which this can be verified. And this is a problem, mostly because we don't know what they're putting here. But even more concerning is the problem that I found when navigating different counties in the area. And so if we go to Anne Arundel County, which here it says that the new COVID admissions per 100,000 is 11.8. And so today is June 4th. And so 2 days ago would have been, sorry, it's a Saturday. And 2 days ago it would have been a Thursday. So they would have been updated. They should have updated this level on Thursday. But this number has not changed at all since Thursday. So I don't know what is constituting when that, or how that gets updated. But the problem is that if we take Anne Arundel County as 11.8 and we go to, say, a neighboring county, you see, okay, what is the COVID admissions over there? And we see that for Baltimore City, it's actually COVID admissions to the hospital is 11.8 as well. And so that's kind of strange because this number is actually per population data, and that's based on the populations that are estimates that are given down here. And you might say, okay, well, maybe that's just a fluke. It's kind of weird. Anne Arundel County is right next to Baltimore City, and maybe that's something else going on there. But if we then go over to Baltimore County instead of the city, we also see that's 11.8. So, for this, the population is much higher than the city itself. And so this is kind of strange that you'd have totally different population, but have the same rate of admissions for the county. 11.8, that's so strange. But what's even more strange, if I can do this again, maybe I'll go down to over to Carroll County, which is actually the county over from, so we're moving a little bit west here. We're going to Carroll County up here from Baltimore County. And we see that it's also 11.8. That's extremely strange, right? So we've gone from Arundel County up to Baltimore City, up to Baltimore County, and over to Carroll. So if I go over here to Howard County, what's Howard County's rate at? That's also 11.8. How is this possible? They all have different populations, but they're all returning the same amount of admissions to the hospital. Could it be that they're all exactly the same to the 10th based on population? It seems very strange to me. And even one more county. If we try one more county in Calvert County, now it's a little more south. You see it's down here, but it's still attached to Anne Arundel, you see. That's also 11.8. How is this possible? How is it possible that all of these counties have different populations, and yet the rate of admissions of new hospital cases are exactly the same to the 10th? It makes no sense. The probability of this happening is extremely low. So you have to wonder, why is the CDC doing this? How is this happening? And the CDC does not provide any information on how they determine this data, and CRISP does not provide a data feed for how this data is created.